I am excited to welcome back Gabby from 4Kira4Moms to our session again. This is our spotlight session number two. And as you heard earlier, Gabby and her team have been national leaders in maternal health advocacy using storytelling and community engagement to drive real policy change to improve outcomes for families. Today, she's going to share her insights on how advocacy and lived experiences and community voices can truly shape maternal health systems and create meaningful change. Gabby, thanks so much for coming back on with us. We're thrilled to have you here again. Excited to hand it over to you.
All right, and I'm gonna. Oh, you got the deck. Okay, great. So good afternoon, everyone. Great to be back. And as Megan mentioned, we do. Advocacy is at the root and the heart of everything that For Cure for Moms does. And so today, I'm going to share with you our newest and our biggest advocacy program, which is 4Kira for Dads Paternal Centers of Excellence. And obviously, given that Charles Johnson is our founder and he has lived the lived experience of losing his wife, Kira Dixon Johnson, 9.5 years ago. This was born out of his personal experience, and specifically in the fact that Charles was that father that did everything. He was at every prenatal visit. He was out running to the pharmacy if Kira ran out of prenatal vitamins, getting her food, doctors, everything. They did their research. They found their doctors. They were there. They had a family all at the hospital together. And this was their second child going in for a scheduled C-section, what they thought would be one of the happiest days of their life. But unfortunately, it turned into tragedy. And in that tragedy, unfortunately, Kira's C-section did not end well. She was left bleeding for 10 hours. A CT scan was called STAT. And 10 hours later, when they opened her back up, she unfortunately bled out because 3 liters of blood was in her cavity and she died. That tragic death was preventable. It was also very preventable because the doctor that they had been going to, it changed on them. And it was a new doctor who did her C-section. And so what Charles realized in that moment, as well as almost 10 years later, is had he been more prepared on what to do in the postpartum, as well as what happens after if you lose a partner, if you lose a child, the grief, he realized that men could be truly, truly more beneficial allies, protectors than they are today. But they're not informed in the current environment up until this year, because I will say this year is like the year of the father. You've heard from Brad from Dads to Doulas as well. We're going to talk 4Kira for dads. But dads have typically been secondary when it comes to maternal health. But the reality is gone are the days of men being in the waiting room, smoking a stogie and waiting for someone to come tell them what the sex of the baby is. They're willing participants. But where do men go to learn about their pregnancy journey? And yes, I said their pregnancy journey because they're on one too. They're there as the provider and the supporter, and they can also be the first line of defense. But when we look at all the apps out, there's nothing for men. You can get a login to My Pregnancy Journey, but we weren't able to find much for fathers. And so we decided to come up with 4Care for Dads Paternal Centers of Excellence. It is the first of its kind program, and it's free. And it's based on the thought that the statistics in the United States, we know it all too well. 70% of the number of Black women who are dying at a rate of 100,000 lives per death, 3 to 4 more times likely than white women. 84% of these deaths in the United States are preventable. And more importantly, we know that when dads are involved in pregnancy, mothers are 1.5 times more likely to receive prenatal care in the first trimester and have positive effects. So we decided to skip all the research and just come out with the program. And so 4Care for Dads Paternal Centers of Excellence is based on that belief. Specifically, that in order to eradicate maternal mortality, a third pillar of the maternal health ecosystem is needed. It's time to focus on paternal education and well-being so that fathers can be of service and advocate for mother and child. What we like to say is it's always been a dyad, mother and child. But if you add that third powerful pillar, you create a trilogy, you create a triad that can help to solve the 84% of preventable deaths immediately while we wait for the healthcare system to crumble and be built back up. So, about the program, 4Kira for Dads, it's open to all fathers. However, it is based on the development needs of Black women and their partners. Why? Because we just mentioned they are 3 to 4 more times more likely to die. But what it's meant to do, it's going to educate, it's going to guide, and it supports our men. It's our efforts are centered around changing the narrative and roles in fathers and maternal health, elevating them to their rightful position in the ecosystem to make sure that they can be the number one sense of defense for our women. We're tired of hearing everybody say self-advocacy, self-advocacy. Why do we expect women in the most painful thing you can do humanly possible to be their own advocate? Everybody around them, their village should be there advocating them. And that partner can be that first defense. But we have to teach them about what their needs are, what women are going through, so they know what to say and they also feel empowered to say and do that. Next. And so what we've created is locker rooms, safe spaces for men, places where they can convene. It's a curriculum based on their needs, developed by both dads and their partners. And what other unifying place than a locker room in sports? Why? Because no matter if you're Tom Brady or the water boy, everybody's socioeconomic factors doesn't matter. When you go into that locker room, it's an equalizer effect. The coach is going to yell at everybody. They're going to teach everybody. Everybody's expected to learn their playbook. And so here it's carefully crafted so that men can be listened to, they can learn at their pace. And it's designed for dads and partners to equip fathers with their tools. So to give them playbooks, step-by-step directions so that they can be the best supporter. So when we think about it, right, instead of trimester 1, trimester 2, we're talking first quarter, second quarter, third quarter. We're using men speak to help them better understand the pregnancy journey for women and maternal health. Next. And so what are our program pillars? There's 3, specifically designed to ensure fathers have a better understanding. 1, it's awareness and training. We're giving them the hands-on tools, the resources. It is a step-by-step training by as I mentioned, by quarter, designed for them in a learning guide. So there's 6 to 7 self-guided training modules that they'll be able to go through using playbooks and sports themes and analogies. Second, it provides healing networks and spaces for men to talk about. Where are they able to really learn about these areas? They're not talking about in the barbershops. Where do men go? We have tons of women's support groups. But here's an opportunity that both virtually and when we get to in person, they'll go to. And third is teaching them advocacy and agency. Number one, that they feel that they are empowered and can have agency over their own pregnancy. And then we're inviting veteran coaches and dads to come back and to help teach the next generation of fathers. So this program is not just for expecting. We need fathers and grandfathers to come back and to help teach men why their role is so vital. To talk about, hey, you know what? These are the things I did right. These are the things I didn't do right. These are the things and the tools that I wish I had to better help prepare my partner. And so then we're talking the curriculums. And as I mentioned, we're using them in the sports themes. And so we have the 6 phases of the pregnancy journey. First up is warm-ups and pregame. We're talking family planning and preconception. So ideally, when all is said and done, this is where we want all men, regardless of age and where they are, to come before they're having a child, to learn about what are the dynamics of families. For example, 4Kira4Moms were headquartered in Atlanta, Georgia. In Georgia, if your name is not on if you're not married, your name doesn't go on the birth certificate as a man. You have to go through a legitimization process, no matter what the health of your relationship is. A lot of men don't know that. So how do we prepare them up front for some unnecessary things like that? How do they think about wills and power of attorney and medical directives, things that we need to know before the day of? First trimester, so conception to 12 weeks. So now what are all the post-warning pregnancy warning signs. How do you pick a doctor? How do you ensure that in that conversation with that doctor, it's a three-way conversation, not just, hey, mom, how are you doing? But hey, mom, hey, dad, how do you push back on a doctor? How do you ask the right questions? In quarter two, second trimester, now we're going to talk about, what is our birth plan going to look like? What are gestational diabetes? We're partnering also with Count the Kicks between quarter two and three so that they know how to count the kicks and know about fetal heart monitoring. In quarter four, it's not over. Postpartum, we know that 50% of deaths are occurring in the postpartum. So, what can men do? What are the postpartum warning signs? What do you do if she's not feeling well? All throughout this curriculum, we're talking what about blood pressure monitors and understanding your partner's baseline, all of the key things that men can know to be a better provider. And then overtime, fatherhood, we're talking 3 months to 2 years up. And so, what are the tips that you can continue to make sure that your partner and your baby thrive? And in it, we have access to expert-led modules on topics. So, like I said, we partnered with the experts. Count the Kicks helped us create a curriculum. We've got Nurture, who's helped us with mental health. We're working with Happiest Baby and the SNU and Dr. Harvey Karp on the ways to swaddle. We've got Walmart, who's helping us with nutrition and helping us power our efforts. Healthy Start and Nick HQ, 100 Black Men of America. And so one thing at 4Kira4Moms and Dads is we have no pride in authorship and ownership. So if you've got a curriculum, please tap in, send it to us, work with us, because all we want to do is take that curriculum today, package it up, and put it in language and speak for our fathers. We're working with our IT and learning CMS system to make sure, LMS system, to make sure it's on a 6th grade reading level. So it's accessible to everybody and men can truly understand this. So my hope is next year we'll have even more partners who want to work with us, because our goal is to get this to everybody, because I did mention it's free. Next. And so, as I said, it's a website and an app. Right now, it's live on website, www.4kira4dads.com. And the app is back into production, and we'll have both iOS and Google, and we're hoping that we'll redrop those apps later on this month. Quarter one and quarter two are live today. Quarter three is going live next month, and we'll have quarter four by the end of the month. And again, it's a free website and app that any man or partner can join. But outside of that, we're taking this to in person. And so this summer, we had the opportunity in Georgia, with the help of Hope for Georgia Moms, to do 4 in-person sessions where we took these individual curriculums and picked out and then brought in the experts to teach and to share. So we had its game time where we worked with ACT and how do you push back and ask the right questions, and we put men on the spot. What happens if they say, let's time to induce? What do you do? How do you push back? How do you say, is this the only option? What are the safety options? What are the other things that we could possibly do? How long can it take before we have to induce? What if you don't want a C-section? All of those types of things we're talking. Then we also talked about, we had a doula, we had a midwife to explain what's the difference between a doula, what's the difference between a midwife, what's the difference between an OBGYN, and how do you create your team? Because you can have them all, and how do each individual roles work. Then we brought in Calm Under Pressure with the American Heart Association, and we actually brought in blood pressure cuffs and taught men to take their blood pressure, not only for themselves, but more importantly, to learn their partner's baseline, because we know that cardiovascular is also impacting our maternal deaths at over 50%. And one of the biggest things is knowing your baseline, not just knowing the chart, because the reality is if you've got 100 blood pressure, if you get to 150, that's danger levels. But you call a nurse or you call a doctor's office, they might just tell you to lay down. No, what are the danger levels that you need to know? What does preeclampsia look like? And making sure that they understand it can happen in the postpartum. Stress management as well. We brought in massage therapists for the partners and for the men, because we know that being in their pregnant journey, it's such a high stress environment. So how do we teach men how to de-stress themselves and also de-stress their partners? Then we had handling your business. How do you financially prepare for a baby with budgeting and expert advice? We had somebody from our the judge's office here come in about advanced directives in the county's office, advanced directives, wills, probate attorney, and then also what about insurance, parental planning, and paid leave. And then lastly, we had post game prep. So, how do you create a postpartum plan? So, you know what, man, what is one of the first things you could do? Create a meal train for your partner. Let people know who is allowed to touch the baby. Do people need to be vaccinated? Are you talking about those things? What are the very most important things, as well as, again, what are the postpartum warning signs so that they can be that number one um, protector that if something goes wrong? When do you call 911? When do you take them to the ER rooms? Next. And so we would love for everybody to join 4Kira for Dads. I mentioned it's free. You can join the team. You can reach out to me directly if you'd like to bring this to your city. We're working on a playbook so that we can hand it to partners so that they can host in their cities. If you got sponsorship dollars, we can come out with you. But we want this. Our idea is one day that this will be synonymous with Lamaze, so that when every man gets pregnant, they're given 4Kira for Dads so that they have a journey, an environment, and and a or and a village that helps them to help our women and our mothers thrive and stay healthy in birth.
That was wonderful. Thank you so much. And I loved all the playbook. And I don't know much about football. Like my team, my staff here can they understand that, but I picked up on it. I got it. So that was great. I think you got tons of love in the chat, and I think you're just going to be inundated with outreach and connections. And this is truly, truly amazing and remarkable. And we're so happy to be part of this amazing work that you're doing, Gabby and Charles and the whole team there at 4Kira. So thank you so much for being our second spotlight session.